It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, everyone. This is Dr. Tammy Keiser, and today on Optimal Health, I'm really happy that we have Dr. John Fakhouri, and he is with the Laser Masters Relief Now Pain Centers, and he also is a chiropractor in Lake Worth, Florida, and he uses Class 4 laser therapy as part of his drug-free approach to help patients heal from pain, restore function, and live active, healthier lives. So welcome.
Thank you, Dr. Tammy. It's great to be on with you.
I'm really excited because here we are, hot Florida right now, but it doesn't really matter because this Class 4 laser therapy it's been around a long time, right?
Yes, it's been around since, I think, the late 1800s.
Oh, really?
Yeah, they were using laser for all kinds of things.
And isn't it interesting that it's one of those things right now that we need to educate the patients so that they know what it is, how it works, and the fact that they can actually get real pain relief without drugs or surgery. Or if you have had surgery, obviously it can help you heal faster. So before we get into that, I want to just ask you about your background.
Absolutely. So I originally come from New Jersey, and I moved to Florida in 2010 to work for the federal government. And at the time, I was also pursuing a law degree. And while in law school, I suffered a CrossFit-related injury that left me in constant debilitating pain. And I saw multiple healthcare providers, but it was the same thing with all of them. They would do an examination, check it out, tell me that just to rest at home, use ice and heat, and take muscle relaxers. And it wasn't really helping me, and nothing helped. And I started getting, I don't know, I just didn't want to go to regular doctors anymore. So a friend of mine actually referred me to a chiropractor. And I was hesitant at first. I said, it's probably going to be the same thing. I'm going to go to a chiropractor. They're going to recommend. I didn't know at the time that they don't prescribe medication. This was back in like 2014, 15. And so I went and I couldn't believe it. My shoulder got better fast. Within 3 weeks, it was better. We did all kinds of different therapies, and it made me want to switch careers. I actually left law school, which I went for originally. My undergrad was in political science. And then I got into the federal government because I wanted to be a special agent. But it was taking a little longer than I wanted to. So then I went back to law school, and that's when I had the injury. But I wasn't into it as much as I thought I was. I used to love criminal law, and all I used to watch was criminal shows, but it wasn't the same when I was in school. So that's what got me to switch to chiropractic.
And isn't that funny how we watch, CSI, how many CSIs did we have, or the law shows. I date myself with LA Law. And I actually just binge watched Suits not that long ago. But we have this vision in our head of what law is. And a lot of it probably is really just boring stuff.
Yeah, when you're in school, all it is reading 400 pages a week.
Arguing.
Breaking down cases. Yeah, it's not the same.
So you had hurt your shoulder in a CrossFit accident, and you found chiropractic. It relieved you so much that you actually changed careers.
Yeah, when I was in the office, I got just how fast I got better. I was amazed, but it caught my interest.
So you're in Lake Worth, Florida, and that's a very pretty area. I did a little research on that part of Florida, and it looks like it's a really nice area for people who want to live an active lifestyle. So why did you choose Lake Worth?
So I chose Lake Worth. When I moved here back in 2010, I actually, my parents had a place right around the corner, so I used to be there. So I've pretty much been in this area for 15 years. And so it's pretty much my home, and I love treating the people in my community, giving back to the community. They've always been there for me when I needed something. So that's the reason why I chose Lake Worth. I've been here for 15 years, and it's like a good family area. It's a family community, and I like that.
Yeah, it looks like a really nice place to live. So with your chiropractic care, I'm curious to know, you have the chiropractic office, and you called it Vibrant Vertebrae, and
Yeah.
then you have the new adjunct or companion Relief Now Laser Pain Center. So tell me, what are your areas of specialization, would you say, in both fields?
So Vibrant Vertebrae, spinal injury and pain relief, we specialize in evidence-based chiropractic care. So we tailor all of our we have a wide range of spinal musculoskeletal. We treat a wide range of spinal musculoskeletal conditions. And some of our core focuses include spinal injury rehab, so auto accident care, sports injuries, work-related injuries. We also do chronic and acute back and neck pain relief. We do sciatica, herniated discs, nerve impingements, postural correction, and spinal alignment, headache and migraine management. So we do a lot of things, corrective chiropractic care. So after you get better from an acute injury, you can keep doing, it's either maintenance or corrective care to keep your body in alignment so that it doesn't come back. A lot of people forget when you get an adjustment, the body has muscle memory. So after you get adjusted, the body tends to pull it back out. So when you're recommended more visits in the beginning, it's not because the chiro just wants you to come in 3 times a week. It's for the muscles to start getting used to it. And then that's why people continue with maintenance care to keep the body in alignment.
So it sounds to me like, for you, adding class 4 laser was a no-brainer, because everything that you just described can also be helped with class 4 laser therapy. Is that true?
Yeah, it helps us treat a lot more symptoms that people have, not just back and neck adjustments, not just manipulations. Now we can treat joint injuries, knee injuries, ankle injuries with the laser therapy. So it gives us a wider range of treatment for the patient. It's better for the patient and for us.
So with class 4 laser, what do you think the biggest myth about it is, that when your patients come in and are asking questions, what are they asking you, and what are their big fears?
So they ask basically what it's about, how it works. And I pretty much explain to them how we offer something truly powerful in our office. And we actually call it regenerative medical laser. So it's pretty much energy medicine for your cells designed to help your body heal faster naturally. And it works through a process called photobiomodulation, basically light triggering a healing response at the cellular level. So the easiest way to picture is if you think about like plants, and they get they get the sunlight through photosynthesis. So it's like photosynthesis for your body. So on the surface of each of your cells, you have light receptors called chromophores. And these receptors are directly connected to the mitochondria, the powerhouse of your cell that produces energy. So basically what it does when we apply the laser therapy, it activates those receptors and tells the mitochondria to produce more ATP or cellular energy. And this flood of ATP kicks into your cells into gear, and they begin repairing tissue, reducing inflammation, increasing circulation, and bringing more oxygen and hydration to the area that needs healing. And most patients notice that the treatment feels soothing. It delivers a relaxing warmth that people actually look forward to.
So if you were to take all of that and just put it into a couple simple sentences, what would you say that, like, if you were trying to explain it to me and I'm like 10, how would you describe that to me?
What the class 4
The
laser does.
process of what the laser does.
So basically what it does is class 4 laser, it delivers red, near infrared, like light energy deep into the tissues. And the light stimulates a process, like I said before, called photobiomodulation, where the cells absorb the energy and respond by increasing the ATP. So basically, it's just the light energizing the cell to reignite the ATP. So basically, they're sleeping, and then it helps reignite the energy for the cell to help with the healing process. Helps the body heal faster, so it goes right into the cells.
So it's like you just said it. It's like it's waking up the parts of your cells that create the healing, that seems like, if they're like awake or whatever, stagnant, because I know, your body sometimes will go to sleep or something, certain parts of it. So so when people come in and they have the laser and you're either doing it separately or you're augmenting, what would you say, how long can they expect the different treatments to last?
So in many cases, people start to notice a relief or a difference in the symptoms within 1 to 3 treatments. But we recommend 12 to get the full amount of for it to last long. If you do 1 to 3, you might feel a difference, but they recommend the 12 so you get the lasting relief of what it's really supposed to do. It doesn't just get better in like 1 to 3 treatments, but you could feel a difference. That's when most people start to feel the difference between 3 and 4.
So you talk about the thing about drug-free pain relief and all of that. So when people come in, you even said it, I think, in your own case when you went in to the doctors when you had your CrossFit injury, they were saying ice, key, muscle relaxants, right? So obviously they were giving you medication to try to relieve the pain by relaxing the muscle. But of course, that creates all kinds of other issues with limitations on what you can
Yeah,
do.
the problem with that is it doesn't get to the root cause. So doing the treatments like this, we actually find as chiropractors, we find the root cause and we treat it that way. We don't just treat the symptoms. So this will help treat the root cause, because when you take all the medication and the shots, pain shots, they only work for so long, then it comes back. So you're not really helping what the problem is. You're just masking it. So yeah, we will actually find the root cause. And it's a good conservative alternative for managing pain or inflammation, especially in chronic pain or soft tissue injuries and joint or nerve inflammation. The laser will help. It helps reduce inflammation, increases oxygen and hydration, so it helps with the healing.
So you mentioned that your particular injury was a shoulder. In Lake Worth, obviously, it's people have really probably active lifestyles. They play golf, they play tennis, they probably work, swim. What type of injuries do you see the most of in your practice?
So a lot of you're asking what laser is good for, or what I see.
Yeah, well, what you see and how you would treat it, obviously, because you're both a chiropractor and a class 4 laser doctor. So I imagine you look at it and determine what's going to be best.
Yeah, so the laser is good for arthritis. So arthritic conditions, a lot of people get the injections in the knees and injections in the shoulders. So the laser is good for that. It's also good for tendonitis, like plantar fasciitis, golfer's elbow or tennis elbow, shoulder arthritis. It's good for that. It's good for back and neck pain, sciatica, carpal tunnel syndrome. So to avoid surgery, a lot of people get the carpal tunnel surgery and sometimes they start to tend to see weakness after, or it doesn't help. And then it also, like I said, plantar fasciitis, sprains and strains, it's good for. It's also good for sports injuries, and post-surgical healing is really good for.
Is there any limitation on how old somebody could be, like how young or how old, in order to be qualified for class 4 laser? Are there any side effects?
No, the side effects are actually minimal. Some side effects are temporary soreness, redness on the treatment site, rarely increased pain initially, which is like a healing. Sometimes you'll get more pain than you came in with. It's usually your body reacting to the healing. So that's it. No, there's no really age limit. You can use it at any age. And yeah, it doesn't have too many side effects. They're very minimal.
So I am someone who did get a shot in the knee, and that shot hurt more than the pain in my knee. And then it wore off after a couple of months and my knee still hurt. So is there any pain during this treatment at all?
No pain at all. You feel like it actually feels good. It's like a warm, soothing feeling. It's relaxing. It's like not massage, but it's warm to the touch. You actually start to fall asleep a little bit.
So it's
So
just
it's very soothing.
warm. And
We also have the shockwave therapy is great, but with shockwave, you'll feel immediate relief, but it's a lot more painful than the laser. But the laser is regenerative, so the laser actually helps fix the tissues and repair them at the cellular level.
so in your office, you have the chiropractic, the shockwave therapy.
Also with the chiropractic, we have So we have obviously spinal adjustments, auto accident care. We have spinal traction, shockwave therapy, electric muscle stimulation, ultrasound therapy. Uh, we also have a massage therapist in the office if somebody needs a massage. Then we have the laser. We do prenatal chiropractic care, pediatric chiropractic care. I don't pick like some chiros will just do sports chiropractic or pediatric. I pretty much treat everybody. There's no certain thing I stick to. So we pretty much have everything. We do rehab. So we pretty much have it all in the office. We also have a dietitian, nutritionist in the office, registered dietitian. So she can help people with that.
You were talking about what caught me was when you were talking about the prenatal care. Can you do the class 4 laser with pregnant women? How does it work?
No, when somebody's pregnant, you don't want to go in the area.
Right.
You can laser other parts like joints and stuff. You don't want to go near the stomach or the thoracic spine. Yeah.
Okay. So
yeah, anytime with pregnancy, with all that stuff, you want to watch.
Right. So like, who would the people be that would not be good candidates for class 4 laser therapy? If they were thinking about it, obviously you wouldn't want to be, if you're pregnant, you wouldn't want to.
Yeah, if you're pregnant, you want to watch. If you have like open wounds or something in that area that needs it, you don't want to laser over that. Other than that, there's nothing really that's contraindications for it, other than the pregnancy. If somebody has a pacemaker, you probably don't want to go in that area, so you stay away from that area. But no, there's not too many contraindications for it.
So with all the different therapies that you do, it sounds, and like you said, you take care, like the whole family, I guess would be how you would look at it when you talk about the child, the neonatal, the pediatrician, all the way up through the older people. So you're like more of a family chiropractic physician with the laser pain center augmenting, because you take care of like the whole family.
Yeah, we treat whole families.
Yeah. Well, that's really different.
We like to keep it like a family practice. It's me
Yeah.
and my fiance here. She's the dietitian. I'm the chiropractor.
Oh,
we
cool.
run the whole place ourselves.
Well, that's
And the whole area has got like a family feel. The whole shopping center in the area around us.
So, what type of hours do you keep?
So we work 9 to 6 Monday through Friday, and Saturdays we do by appointment only, and we're closed on Sundays.
Oh, so you actually you're open every day plus by appointment on Saturdays. Most chiropractors, like their hours are really short. I noticed that sometimes it's hard to get in to see a doctor, when you're injured. That's really good. So
so you were asking about, you also don't want to get the laser in somebody's eyes, and if they have the
cancer. Yeah, they wear their little glasses.
Yeah, so we have them put on their goggles, and if somebody has cancer in there, you want to be careful. But other than that, it's a really safe modality.
So normally, if somebody comes in, what can they expect? Like your process, like what questions are you going to ask them?
So when they come in, we do a detailed consultation, a detailed exam, and then if it's laser, we'll see what's going on. If they need the laser treatment, and we'll set the treatment plan with that. But if they need adjustment, we'll do the detailed exam, like I said, and then we'll do the adjustment and whatever treatment they would need. So we spend a lot of time with the patient. I like to learn about the patients first. I like to learn what's going on, how long they've been dealing with it. It's not like an in and out. I actually like to sit with them and educate the patient, make sure they understand. It's about learning what the patient needs. You don't want to just talk about yourself and how good you are. You want to learn what's going on with them, how long they've been doing it, where they've been before, what's working, what's not working, if they've had imaging, if they haven't. If it's something that's been going on for 20 years and it's not getting better, there might be something else going on. So we do a detailed consultation and exam and history just to make sure we get to know the patient and what's been going on.
Well, I think that's really important because sometimes some doctors, they give you 15 minutes total, and it's like they don't know anything about you. So that's really good that you do such a complete, comprehensive program.
Yeah, and people like to be heard too. They don't want to just go to an office and they feel like they're in and out. They want to be understood and heard, so it's good.
Well, yeah, and if you're going to go into a doctor's appointment, you don't want to be in the waiting room for an hour and then with the doctor for 5 minutes. That's always a real disappointing experience. What would you say of all the things that you do is your most rewarding part of this? Because, like you said, you literally switched gears and went from law to become a chiropractor and now a class 4 laser doctor. What do you find so rewarding about all this?
So the most rewarding part is seeing the lives change. You see people's lives change. When someone walks in feeling hopeless, limited by pain, and then over time they start moving better, sleeping better, smiling more. That's powerful. That makes you happy. And helping people get back to doing what they love without relying on medications or surgery is why I do the work I do. It's not just about treating pain. It's about restoring quality of life for people. And you get to see that when they come in, they thank you. Oh, you changed my life. I had a patient that was getting ready for a marathon and they weren't getting better. And within a month and a half of treatment, they were able to it was actually a triathlon. They didn't perform as much as they wanted to because they were still in a little bit of pain, but they were still able to attend, which they wouldn't have before if they didn't come to us. So
Well,
that kind of stuff is rewarding.
Well, yeah, because think about it. If you're somebody who's doing a marathon or a triathlon, that means you're really dedicated to whatever that program is. So if somebody, like you mentioned, that sometimes people come in and they've been in pain for like 20 years, what advice do you have for people about chronic pain and paying attention to their body? And what if they're like, oh, I've had this 20 years, it's not ever going to go away? What's your advice?
Not to settle for the pain as your new normal. The pain is a signal. It's not a life sentence, and there's help out there. And to try and figure out what's going on and not just you don't want to just mask the symptoms, whether it's chiropractic care, laser therapy, or rehab. To seek the provider who listens, looks at the root cause, and builds a plan around you. And healing is possible. So you don't have to live like that. I try and reassure them that there's things we can try. There's always, if one thing doesn't work, if the laser doesn't work, then there's other options we can try. We could try shockwave. We could try the ultrasound. We can try chiropractic adjustments. There's always something we can figure out. And if not, then I refer them to the specialist they need to go to.
Well, that makes a lot of sense. So how can our listeners find out more about you? How do they get in contact with you? What's the best way?
So it's pretty easy. You can Google us and you can contact us. You can visit our website at www.vibrantvertebrae.com, or you can visit us at www.reliefnowlaserlakeworth.com. Or like I said, you can go on Google. You can call the office. The number is 561-969-8284. And we're conveniently located in the Lake Charleston Shopping Center in Lake Worth, Florida. So then I think the easiest way would be to Google us, and all the info is there, the phone number, the address, and you can contact us. I actually have my phone with me 24/7. So if anybody needs anything, they can always call and we always answer.
Wow, right there, that personal service, that's something that most people don't have. So everyone, thank you so much, Doctor. We really enjoyed listening to you and getting that insight about, a little bit about your background and then about your chiropractic services and the class 4 laser. So before I let you go, is there anything you'd like to add?
No, that's it.
Okay, great.
Thanks for having me. I appreciate it.
Well, thank you. So everyone, this is Dr. Tammy Patzer, and this is Optimal Health, and it's sponsored by Relief Now Laser Methods and the Laser Masters. And thank you a lot. I really appreciate it. And we'll talk to everybody real soon. Thank you.
Thank you.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit optimalhealthradio.com.